Structural racism has been closely linked with health disparities in the United States. So, what is structural racism? Structural racism is a system in which public policies, institutional practices, and other norms perpetuate racial group inequality. And what is a health disparity? Healthy People 2020 defines a health disparity as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. Racial disparities in public health are linked to disproportionate maternal mortality rates, higher death rates from diseases including heart disease, stroke, cancer, asthma, diabetes, and COVID-19, and higher rates of chronic diseases that are related to stress. Here is the chart that depicts racial disparities in pregnancy-related maternal deaths in the United States. As you can see, American Indian and Alaska Native women have over twice the amount of maternal deaths than white women, and with Black women, the rates are 4 times higher than white women. The Journal of Midwifery and Women's Health published some unfortunate statistics about the topic. They found that increased maternal death rates were correlated with lower levels of prenatal care. There are many systemic reasons why minorities may have lower levels of prenatal care. Researchers at NIH have found social and environmental inequalities linked with a lack of prenatal care, as well as bias and discrimination in the healthcare system. This graph shows the changes in avoidable deaths from cardiovascular disease over 10 years. As you can see, the amount of avoidable deaths are decreasing, however, the racial disparities do remain. According to the CDC, Black Americans are twice as likely as white Americans to die from heart disease and stroke. The American Journal of Emergency Medicine did an analysis in 2019 that revealed Black patients were 40% less likely to receive medication for acute pain compared to white patients. Bias and discrimination in medicine clearly has disproportionately deadly effects for minorities that we as a society must work towards stopping. This graph from the Kaiser Family Foundation shows the rates of asthma, diabetes, and heart disease among different racial and ethnic groups in the United States. American Indians and Alaskan Natives and Black Americans suffer significantly higher rates of these chronic diseases. Research from NIH has shown that this is linked to lower health insurance coverage, differences in quality of care, and stereotyping by providers. These factors are examples of systemic inequalities and how they impact public health for minorities. So what can we do to address these inequalities and prevent racial health disparities? One thing we can do is vote. We can support local and national officials who promote health equity, access to healthcare, and show clear support for racial equality. Systemic racism exists on such a large scale that policy development and changes are necessary to fight inequalities in health. Another thing we can do is provide educational resources to health professionals that address common discrimination and bias issues in healthcare. Health professionals need to be held accountable for unfair treatment of patients based on race and ethnicity. Another important step we can do is support research in eliminating healthcare inequalities. As technology, research, and science advance, our ability to eliminate racial inequalities in public health should advance as well. The members of Eta Sigma Gamma are committed to reducing racism and the health impacts of racism through education and awareness.